tiptoeing up here. Let's wait. Machicho. What are my hopes for the healthcare system as an Indigenous woman? My name is CeeJai Julian, and I come from the Carrier Nation in Fort St. James, BC. My reserves call Nagazli, and I belong to the Beaver Clan. My given name as an Indigenous woman is Shining Eagle Woman. I've lived in the Lower Mainland for 43 years, and I've worked as a peer specialist in Vancouver Coastal Health that was contracted through a nonprofit organization called Rain City Housing. I worked on an all-women's team for women, besides social workers, RN nurses, nurse practitioners, and psychiatrists, and at one point, a doctor. On the team we worked with marginalized, impoverished women, which were 60% Indigenous women. My job gave me an opportunity to help them and lift their spirits up and connect them with services in the healthcare system, helping in any way that I could so they were able to get wound care, proper medication, STD testing, and to help fight their abscesses, pneumonia, and often giving them on-the-spot pregnancy tests. I felt that it was beneficial to have me as a peer specialist with lived experience. I can relate to them. I can feel, I can relate to what it feels like to be homeless, to have no ID, and to be afraid to walk into a medical clinic or a hospital with my complex trauma. Clients were more open and I'm nervous. Clients were more open with me immediately when I told them part of my story. I'm a recovering drug addict. I was on the streets, homeless, until 17 years ago this coming May. I have a home today. I know how scary it is to walk into that clinic and not have proper ID and to feel judged. I feel that these women that I work with are amazing, beautiful, strong women with beautiful spirits. They have numerous things happening to them. That's their stories to tell, and for me to be a witness. It is crucial to have all women and all women's team working in the downtown Eastside. For the women, many of them would never ever walk into a clinic without a peer like me or someone from our team as a support to witness how they are actually treated by the professionals. Many of them would have died without the care that they needed. Unfortunately, we did lose 2 women. One had a massive heart attack right in front of us. The other woman died in an SRO where she lived. Both were Indigenous women. Our team was constantly re-traumatized by what we've seen and how the women were treated seeking help in the healthcare system. The judgment happens right away. Most of our women don't have ID. So they're judged for that. Or if they don't have a fixed address and live in the downtown Eastside, the poorest postal code in Canada. They're in a place where they're vulnerable. And then they are judged and experience systemic racism by the health professionals. You can feel it. I've felt it, especially in the emergency rooms at the hospitals. When these women are being judged in the emergency room, they're often thought of drug-seeking, wanting pain medications, and they're not just walking into a hospital for something to do. They're the best experts of their body and what they need. I've seen what is written on their chart. People labeled, as soon as they walk in the door, there's red ink stating that they're a violent or a drug addict. Sometimes this information could have been from 10 years ago, but they're still judged. I have firsthand experience being treated like this in the healthcare system, and I can see how it still happens today. My hopes for change would be to have non-judgmental, compassionate, caring, understanding, right from the moment that you walk in the door, instead of them being behind the glass wall in the bubble, which it's like they're scared of us. My hopes is that they would have an Indigenous person beside them. And that the health professional would learn more about Indigenous people. People need to understand the effects of residential school, the 60 scoop, and the child welfare care system of why our children are in care. And all of these things have impacted my life personally. The things I've seen that give me hope are the fact that the women in the intensive case management team exist. My best hope is that they would add peer specialists at the emergency rooms in all areas of the healthcare system. There is so much work that needs to be done, and if people don't do the work, more people will die preventable deaths, like my daughter. My daughter was 25 years old. Her name was CeeJai Julian. She was driving to work and crashed her car. The airbag went off. She walked to a 7-Eleven store to get help. The RCMP showed up. As soon as they saw my daughter, instead of calling for an ambulance or for help, they handcuffed her and put her in jail for two hours. Her friends from work had to pick her up. She went straight to work without even seeing a doctor or a healthcare physician to help her. On the third day, she was complaining. She was complaining of discomfort in her body. And she tried to walk into a walk-in clinic in Chilliwack. The lady at that reception said, "We're past our quota. Go see your own doctor, your own family doctor in St. Albert, Alberta." As a result of my daughter, she went home, she went to sleep, and she never woke up. It broke my heart. It broke my heart to the point where I went on health leave from work. I attempted suicide at one point, and I had to seek for help with trauma-informed psychiatrists and nurses out of province. We need more healthcare care programs like this here in Vancouver. They need to be Indigenous focused. And my hope is that this attitude can change from the receptionist to the physician and to the nurses, to the gurney that pushed my daughter in the coroner's gurney to the coroner's office. At this time, it would be my greatest honor if I could sing the Woman's Warrior song. I know it's past 6 minutes and 40 seconds, But this is to honor each and every one of the women in your life, as all of the women that sit here ahead of me and in front of me. Hey, 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 yeah, he, oh, yeah, he, oh, hey, hey, yeah, he, oh, yeah, he, oh, hey, hey, yeah, he, oh. Hey, 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 yeah, he, oh, yeah, he, oh, hey, hey, yeah, he, oh, yeah, he, oh, hey, hey, yeah, he, oh. Hey, 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 yeah, he, oh, yeah, he, oh, hey, hey, yeah, he, oh, yeah, he, oh, hey, hey, yeah, he, oh. Hey, hey, yeah, he, oh, yeah, he, oh, hey, hey, yeah, he, oh, yeah, he, oh, hey, hey, yeah, he, oh. Hey, hey, yeah, he, oh, yeah, he, oh, hey, hey, yeah, he, oh, yeah, he, oh, hey, hey, yeah, he, oh. Woo! All my relations.